This has been a YMCA since 1912. It's probably one of the oldest buildings that were constructed to be a YMCA in the country. President Taft laid the cornerstone on the building in 1912. So welcome. And we want to welcome our Governor Baker and Lieutenant Governor Alito. Thank you very much for being here this afternoon. And we're also joined by Marty Martinez, Chief of Health and Human Services for the City of Boston. Welcome. And so today we are celebrating an amazing set of partnerships. And the first of those partnerships is the partnership that we share with the MBTA, the RIDE program. And so in this room every single day, Monday through Friday, there are 1,000 bags of groceries packed, the bags that are similar to the ones in the back of the room. They are nutritionally balanced bags. A family of 3 will have enough food for 4 days, and a senior will have enough food for a week's time. Over the last 114 days, I'm told, 114 days, the individuals who pack those bags, which are a combination of volunteers, the staff of the Chinese Progressive Association, and YMCA staff, pack about 1,000 bags a day. And those bags are then available for delivery to families and children and seniors in the community. And so we could package 20,000 bags a day. But if we have no way of delivering those bags to families, then they would go to waste. And so that's where the MBTA has come in. They have delivered those meals to the families and the children and the seniors in our community each and every day for the last 114 days. And so over that time, we've prepared and delivered more than 60,000 bags of groceries. And conservatively, that represents about 600,000 meals in 114 days. That's an amazing accomplishment and probably one of the most beautiful and best examples of public-private partnership that we'll ever experience. And we're so proud to be a part of it. And we're so proud to partner with the MBTA to make that possible. However, let me also thank the food bank, because without their aggregation of food, there would be no food to put in the bags and no food for the MBTA to deliver. So we want to thank our partners and friends from the food bank who also support that effort to make sure that the children and families and seniors of the Boston community, and Greater Boston for that matter, are fed. We want to also thank the Boston Resiliency Fund, the Shaw and the Lynch Foundation, the food bank, as I mentioned a moment ago, Hope and Comfort for providing us with personal hygiene items that we also deliver to families when those are available. It's been an all-hands-on-deck set of circumstances. In addition to the 60,000 bags of groceries that have been delivered, we've also delivered more than 1 million meals, prepared meals, grab-and-go meals, to the children and families of Greater Boston. And that's been the result of a partnership with City Fresh Food, the Boston Housing Authority, again the Boston Food Bank, Boston Centers for Families and Children, the Boston Public Schools, and many other partners. We've delivered those meals at over 60 locations in the city of Boston. And so in total, we've delivered in 114 days 1.6 million meals to the children and families of our community. That would not have been possible without partnership. That would have not been possible with us all working together to make sure that we do our best to end hunger in the city of Boston. And so with that, I want to thank all of our partners, and I want to thank in particular the MBTA for making it all possible. And so now it is my pleasure to introduce our governor, Governor Baker.
Thanks, James. Thank you, James, and thank you for all the Y does in addition to this. This has obviously been, as James pointed out, a big pivot that's taken place over the course of the past 115 days or so. And we were talking about how many things people have had to do to uproot, disrupt, and change the way they operate to deal with the circumstances and the situations that people find themselves in with respect to COVID and the economic calamity that came with it. And I just want to say to Marty Martinez how much we appreciate the partnership we have with the City of Boston on so many issues, all the time, but especially over the course of the past 3 months. And Steve, to you and the folks at the MBTA, this is in some respects, I guess the way I would refer to it is a pivot of your own with respect to how the T normally operates and how the ride works. I do also want to thank the food bank for the extraordinary work that you all have done. Another big pivot over the course of a very short period of time. And I think in many ways, there's been a lot of work done by a lot of people, some of which gets noticed and some of which doesn't. But the amount of organizations that James talked about when he talked about the players with respect to food insecurity is just the beginning of what is a really long list here in Massachusetts. It's been working on this for the past several months. Before I talk a little bit more about this, I want to just give my daily update on COVID-19. Yesterday there were about 5,800 COVID-19 tests reported in Massachusetts, which means we've now done about 1,066,000 tests since we got into this. Yesterday there were 114 new positive cases. That means the 7-day average for positive case rates has dropped to about 1.8%, which is a 94% decrease from the middle of April. Yesterday's daily report also included a statistic we haven't seen for quite a while. There were 0 new COVID-19 deaths reported yesterday. And as we all know, far too many families have lost loved ones, and far too many friends have lost loved ones to this virus over the course of the past several months. As we've said before, the continued fight against the virus depends almost completely and exclusively on all of us maintaining our vigilance and continuing to do the things that have made such a big difference here in Massachusetts. There are currently about 733 patients who are hospitalized statewide due to COVID-19, including about 120 in the ICUs. That brings the 3-day average for the number of patients that are in hospitals down 89% since the middle of April. Only one hospital is currently using surge capacity to serve patients, which is down from far bigger numbers in the middle of April. Our public health information continues to show the same downward trend on our key metrics that we've been tracking for the past few weeks, which enables us to continue to reopen our economy and to reopen our business community and to help get people back to work. Fortunately, the New England states and most of the Northeast have had some of the same success that we've had in fighting this virus, and that's why effective today, July 1, travelers to Massachusetts from the 5 other New England states, along with New York and New Jersey, will no longer have to self-quarantine for 14 days upon arriving here. As we said yesterday, travelers from other states should continue to observe that 14-day quarantine that we've been encouraging and advising since late March, and no one should travel to Massachusetts who's exhibiting COVID-19 symptoms. The changes to our travel advisory are an encouraging sign. We hope to have more to say about next steps associated with reopening soon. With respect to today's event, highlighting this unique partnership to address food insecurity, as we all know, the pandemic has caused an increase in food insecurity across the Commonwealth. The administration's been working hard with our colleagues in the private sector, in the nonprofit community, and in municipal government, and with a number of foundations to create strategies and programs to deal with this. In May, we announced the recommendations of our Food Security Task Force and invested $56 million in a variety of programs and operations to address this issue. And last month, we joined with the Greater Boston Food Bank to announce the opening of applications for a $36 million food security infrastructure grant program, which we believe will fortify many of the farms and other delivery organizations that are part of our food delivery system here in Massachusetts. That program is open to organizations that focus on emergency food distribution, school meal programming, and innovative ideas like urban farms and community gardens, some of which we were talking to Sheldon and the folks at his organization about. And the initiative we're highlighting today is a unique partnership between the T, the City of Boston, the Y, and the Greater Boston Food Bank to ensure that Boston's most vulnerable residents have access to food. We're all familiar with the MBTA's door-to-door shared ride paratransit service, otherwise known as the RIDE. Since the outset of the pandemic in March, the service has experienced a decline in ridership for all the reasons you would expect, because we urged people to stay home and many chose to do so voluntarily, especially if they were in a high-risk category. That low ridership resulted in the availability of ride vehicles and drivers to provide a secondary function that could be used to support communities. And what made this partnership so unique is that it was driven literally by the men and women behind the wheel of the T's ride service. Ride drivers interact in many cases with some of our most vulnerable residents every day. Early on during the pandemic, they saw individuals who were unable to leave their homes to access food because of mobility issues, quarantine, illness, or because they were high risk. It was these drivers' willingness to help that led to the collaboration with the Greater Boston Food Bank. By the end of April, 20 ride drivers were completing daily food deliveries to Boston's most vulnerable residents, and as of today, ride drivers have completed over 8,000 deliveries, totaling more than 12,000 grocery bags and nearly 60,000 school meals to over 1,200 Boston public school children. Groceries are delivered by ride vehicles to designated homes. We get a lot of help from our colleagues in the city with respect to where they need to go. The amount is based on the size of the household and whether the family's enrolled in the Boston Public Schools Meal Partnership. This partnership is also made possible by the folks here today at the YMCA of Greater Boston, which is the staging location for these vehicles to be loaded up with food deliveries. The initiative underscores the importance of collaboration between community organizations, municipalities, and the Commonwealth to help many of our most vulnerable residents during these unprecedented times. We think this is a terrific and unique partnership. We were talking earlier about the fact that we certainly hope we learn from these partnerships that have sprung up over the course of the past 90 to 120 days, and that we find ways to make sure that we take the very best practices we learned from these and incorporate them more directly into the work we do if and when we ever get out of the state of emergency that we find ourselves in today. And with that, I want to turn it over to MBTA General Manager Steve Poftak.
I want to thank everyone for joining us here today. One of the many troubling consequences of the pandemic has been the growth of food insecurity. And the MBTA is pleased to be part of this partnership to address food insecurity in Greater Boston. This unique partnership between the MBTA, the City of Boston, the YMCA, and the Greater Boston Food Bank has ensured that Boston's most vulnerable residents have access to food. We've been really pleased to offer our ride paratransit service to deliver food to people in need throughout Greater Boston. As the governor detailed, we have seen a significant decrease in ridership throughout the pandemic, and we've been able to use some of this additional capacity we have to support the community. And I really want to pay tribute in particular to the drivers who are out there doing the work, to the MBTA staff, and our friends at Veterans Transportation who have been out there doing the work, literally driving food to people in need who need it. And these drivers know many of these citizens. They see firsthand the need, and they see firsthand individuals with either mobility, illness, or other issues who cannot leave their homes to access food. So, we are grateful for the opportunity to partner with these great partners in the community. We've delivered thousands of bags of food. We've delivered thousands of meals to BPS children as well. We've been able to grow this over time. I want to thank Governor Baker and Lieutenant Governor Polito for their ongoing support of the MBTA. Want to appreciate and thank the City of Boston and Chief Martinez for their partnership and their leadership on food security issues. Want to thank James Morton on behalf of the Y, and also thank Carol Tinkin from the Greater Boston Food Bank for their work. I do want to recognize a few other people. There's Sarah and Lyle, who I think is in the room. So we dragged her away from the front door where she was loading bags up until the last moment. I also want to recognize at the MBTA Mike Hulak, who's here on behalf of the ride service. at the T, and also recognize obviously the employees and the contractors with Veterans Transportation who are doing this very important work. It is a privilege for us to be able to help out in this important community-based endeavor. So thank you for the opportunity, and the MBTA is a citizen of this community, and we are pleased to be able to do this. Now I'd like to invite Chief Martinez to offer a few remarks. Chief.
Thank you, General Manager Poptek, and thank you, Governor Baker, Lieutenant Governor Polito, for being here today and highlighting this important work. Special thanks, of course, to the YMCA and the Greater Boston Food Bank for your ongoing commitment to addressing food insecurity issues here in our community. And a special thanks for us to Catalina Lopez Ospina, who's here with us. She runs the Mayor's Office of Food Access, who's been helping to lead these city's efforts, along with countless numbers of city staff and volunteers from the BPDA. I may be the one speaking, but they're the ones that are doing all the work, that are making sure that in partnership this is really happening. So thank you, Catalina, for your work and the work of the team. On behalf of Mayor Walsh, it's great to be here to highlight the importance of this partnership and the role of the ride and making sure that food is accessible and available to those who need it as we work to combat COVID-19. As the City of Boston continues our efforts to contain the spread of this coronavirus, we have been faced with inequitable impact that we've seen it cause in our community. We've seen levels of food insecurity be exposed to this pandemic in ways that have been shocking to some. But to the leaders around this work from the Greater Boston Food Bank and the Y, this is only uncovering inequities that have existed in our community for too long and that people know well. And the city has worked in partnership to be able to make this happen in ways never before and could not have happened without these great partners. That has included developing an emergency food delivery system to ensure that any Bostonian experiencing food insecurity due to the public health crisis could be helped. A specific focus was given to seniors, BPS families, and individuals either COVID positive or immunocompromised. In addition to all the food sites that were lifted up in partnership with many very quickly, we also launched door-to-door delivery service in partnership since April 8th. And in 2.5 months since then, we've completed over 16,800 deliveries, representing over 23,000 grocery bags given free of charge to those in need. With over 8,000 of those coming from the ride, it's truly remarkable the work that's been done together. These deliveries represent 3,800 unique households that span across every neighborhood in the city of Boston. And this has been done and only possible in collaboration with our incredible partners that we've mentioned here, but as well as volunteers from the Boston Police Cadets, volunteers from Boston Centers for Youth and Families, and the BPDA, and of course, MBTA's ride. Furthermore, the 23,000 grocery bags were entirely built by partners, with the vast majority of them distributed from right here at this location, as well as ABCD in Allston has been a steadfast contributor to this effort. These efforts have been key to ensuring that people have access to the food they need to feed themselves and their families, both in responding to and recovering from COVID. We must make sure we're doing it from an equity lens, and that we continue to find ways to address the needs that we've seen and that have been exposed, and tackling food insecurity is one of those needs. Again, thank you, Governor Baker, for the work that the state has done in partnership with us, not just around this, but around containing COVID and keeping the city of Boston safe. We have much work to do, especially as we see what's happening in different parts of the country. We look forward to continuing to find creative ways to utilize these fruitful partnerships to serve the city of Boston and to work to recover from this pandemic in a more equitable way than we entered it. And that includes a greater focus on food insecurity. Thank you so much. And now I want to bring up, without it being possible, Carol from the Greater Boston Food Bank, who has the food, right?
Thank you, Chief. Thank you, Governor Baker. Thank you, Lieutenant Governor. Thank you, General Manager. And thank you to Wendy and to James for the amazing work that you guys are doing. I am Carol Tinkin. I am the Chief Operating Officer at the Greater Boston Food Bank. I am incredibly grateful to join you all today to continue the conversation on food security, highlighting the amazing work being done here at the YMCA of Greater Boston, who, by the way, only became a GBFB member in March and has already distributed over 350,000 pounds of GBFB food. Feeding America recently released a study showing that Massachusetts is seeing a 53% increase in food insecurity and is the second highest state in the nation for increased risk of food insecurity among children. 1 in 7 people, 1 in 5 children now are food insecure in the Commonwealth. The food bank just closed out the month of June yesterday with another historic distribution. 11.5 million pounds of nutritious food through our 550 partner agencies across 190 cities and towns in eastern Massachusetts. That's 110% growth over June 2019. As you can imagine, the last 4 months have been the largest distribution months in our 40-year history. But none of the work we've been able to accomplish over the last 4 months would be possible during this challenging time without the amazing, incredible, determined partnerships we have in the Baker administration, in the City of Boston, and in the deeply committed and resilient partners of our service network. We've been very fortunate that only 3% of our partner food pantries have closed temporarily due to COVID-19. Many new partners have also stepped forward to help us distribute food in the communities with the highest need, like this YMCA and the MBTA. The unique and creative partnership between the Y, the MBTA, the City of Boston, and the Greater Boston Food Bank is only one great example of new collaborations born out of this crisis. It all began when Danny Levy, MBTA Chief Customer Officer and former Food Bank board member, reached out to me in early March to ask if there might be an opportunity for the ride drivers to deliver food door to door. These drivers had been severely impacted by a reduction in passengers. I told her it was not our paradigm, but to let me talk to our on-the-ground partners in Boston. These formidable people from BPDA, the Office of Food Access, and the YMCA took the opportunity with a ride and ran with it. The COVID-19 pandemic has shed a bright light on the historic need for food assistance, but there is a silver lining. The awareness brought to this issue and the opportunity for new and different ways to solve it together. The Greater Boston Food Bank pledges to continue to work alongside you all and remain vigilant in ensuring all residents have access to 3 healthy meals a day. Together, we will end hunger here. Together, we can create a food-secure Massachusetts. Thank you.
Questions on this?
How long did you expect it would be this way? You had mentioned that in 114 days, 1.6 million meals. Do you see that in the next 114 days too?
I think we're all anticipating that we're going to continue to do this work through the summer. And as I said in my remarks, and so did the Chief and so did James, one of the things we want to make sure we do here is learn from these experiences and incorporate the lessons from this into the way we think about both developing and delivering on food insecurity going forward. I think we all believe that there's been a lot of work done here to deal with the crisis, but I think we also believe that we've learned a lot of things about how we can be better at this and smarter at it, and also more expansive in our ability to deliver on this. There's a bunch of stuff that I've certainly learned over the course of this that where we have access to either federal resources or other private resources or overstocks or a whole bunch of elements that we can incorporate into this. And I know that the City of Boston and a number of other partners around the state have discovered that there are places and spaces and people that they need to be reaching out to and serving, and we need to incorporate that into the way we do this going forward. So I don't know if it's going to be 1.6 million, but it's certainly going to be a game that's going to continue to be played for the foreseeable future, yeah.
What's the situation at the food bank? I mean, how are you holding up? Are you being able to get the supplies that you need to get to continue to fill this need?
If you'd asked me that question 2 months ago, I would have said it was tenuous because the supply chain was very much disrupted. Right now, we are able to, because of amazing donations, monetary donations, we are able to purchase healthy food. We are getting enormous amounts, just recently we're getting enormous amounts of USDA food that is coming from the CARES Act and Families First, and also from what's called CFAP, Coronavirus Food Access Program. It has been different. Certainly the The impact on the facility in Roxbury has been remarkable and hard, and the team there, particularly the warehouse and the transportation workers, have been heroic. We can't imagine that we're doing twice what we were doing last year, or even we did 2 million more pounds than we did last month. And these guys just keep coming back every single day, and they keep saying, we're going to keep doing it, we're committed to the mission. So we've got food, we've got a lot of support from the state, we have enormous support from the city of Boston, we have enormous support from donors, and we hope they won't stop, because we do forecast this disruption in people's lives to continue on for quite a while. Thank you.
Governor, Mass Live reported that you either appointed or reappointed 5 of the 7 members of the Board of Trustees for the Holyoke Soldiers Home. Just wondering if there's any update, if any of them have stepped down, if you've asked any of them to step down?
I think 4 of the 4 that were, the board at the time that Bennett Walsh was appointed was 4-3. We had appointed 3 of them, 4 of them had been appointed previously. I can't speak as I stand here with respect to how we plan to handle that. They currently are working through a legal issue. They were enjoined several months ago, and I think we're going to wait until that legal process finishes before we do anything. I do think 2 of the seats have technically expired. And I'm also hoping the legislature will act on our legislation and create some additional seats for healthcare experts on that board. And I believe the date of the follow-up on the legal question is July 30th.
Have you gotten the latest timeline on the reopening of Norwood Hospital after that flooding? We're hearing it could be up to a year that it's closed, impacting not only Norwood but the surrounding communities.
Yeah, we're talking to Norwood Hospital just about every day, and the whole thing was a cataclysmic event in terms of weather. I mean, I think they got 7 inches of rain in 45 minutes, and under that kind of stress, the culverts and the storm drains and all the rest in Norwood had obviously really significant issues, which played out and rolled into the hospital. And I think at this point, I think all the buildings at this point have been either considered to be significantly damaged or condemned. And our first objective was to make sure we worked with the emergency management personnel and everybody else to make sure we found space and place for all of the patients, which, and again, because of some of the work that's been done by the healthcare community generally during COVID, there are so many more relationships between and among players than there used to be. A very short period of time, everybody who was in that hospital was safely placed in an appropriate setting somewhere else. And the thing we've really been focused on is making sure we find places and spaces for the clinicians so that those clinicians can continue to maintain the relationships they have with their patients. And that's really been our focus for the past couple of days, and we are expecting to continue to have a dialogue with the hospital about what their plans are with respect to the physical structure. And we've talked to our insurance commissioner and basically said, you need to reach out to the insurance industry and make sure if there's adjuster work that needs to get done, it gets done quickly. But I think we're playing this a couple days at a time as more information becomes available. But the first things we were most concerned about was place and space for all the patients, and then making sure we came up with a strategy to ensure that the clinician-patient relationships that currently existed through that hospital and through its outpatient department weren't disrupted. And I think for the most part, we're going to be able to do that. The next issue will be what to do with the physical plant.
Is a year in line with what you're hearing so far, or could it be even more than that?
I've heard a lot of different possibilities on that one, a lot.
Governor, New York has decided to delay indoor dining. They're concerned about a resurgence there. I wonder, what worries you most about moving to the next phase?
I think our biggest concern here in Massachusetts is that we take a victory lap. There are no victory laps from COVID, okay? I've said this many times. I've been a broken record on it. It's not going to take the summer off. And a huge part of why Massachusetts has had the success we've had as a Commonwealth, in addition to the work of many great organizations like the ones that are here today, to fill gaps and provide supports to people during this pandemic has been the commitment people have made to the things that stop the spread. Wearing face coverings, washing your hands, keeping distance wherever you can, disinfecting surfaces, recognizing and understanding that there are very real things everybody can do to stop the spread. And we have a big weekend coming up. It's 4th of July. I really hope people continue to take this seriously. I mean, we've had conversations with the folks in the Treasurer's office about the work that's done on an inspection basis by the ABCC folks. Spend a lot of time in and out of a lot of our restaurants, okay? We've talked to all of, Lieutenant Governor spends practically all day, every day, talking to our colleagues in local government about their responsibilities to make sure that people are living up to both the general guidance and the industry-specific protocols that we've put in place to keep people safe. I think if people do the things they're supposed to do, if they stay committed to those particular protocols, processes, and procedures, and they recognize and understand that they have a significant role to play here, we can continue to be successful in our phased process around reopening. But if you I talk to governors in other parts of the country that are now dealing with some really significant issues, and they raise a lot of things about why they ended up where they are and what's going on. But one of the things they talk about is compliance with the basic fundamental public health issues that have been out there with respect to how to manage the spread. And the second is compliance with sort of the general rules of the road that have been put in place here in Massachusetts and are currently being pursued by a lot of our employers to make sure that we continue to keep people safe. That is, in many respects, the most important thing we all have to do.
Do you think people are going to get lax? Do you think they're going to get a little complacent? Do you think they have been recently?
Oh, look, I think people in Massachusetts, for the most part, have been incredibly good about stepping up and doing the things that make the biggest difference with respect to stopping the spread. I think it's why we went from 30% positive rates in the middle of April to 1.8% for the past 7 days. I think, but there's no, I can't repeat this enough, there's no victory lap here. There's no spiking the ball. There's no big celebration at home plate. There's none of that, okay? This is something that everybody needs to understand, that the virus doesn't care about today. What it's focused on is tomorrow and the day after and the day after. It's looking for possibilities and opportunities to jump from place to place and from person to person. The way you kill it is and contain it is by stopping the spread. And I think at this point we all know a lot of the things that we can do as individuals and as organizations to stop the spread, and we need to stay on those things, summertime or not.
Governor, we've had a chance to see over 100 emails from the feds to the state from January to March. They were all downplaying the dangerousness of the virus. Do you think the state would have taken different steps if those emails weren't so reservoir?
You know, there were a lot of mixed signals coming from a lot of places all the way through the early part of this. And I think that's because a lot of people were still just trying to discover what the nature of the virus was, how it worked, what it was about. And I certainly think that, and that's a little bit on everybody, but I hesitate to point too many fingers because we have continued to learn about this as we've gone along. And even some of the top players in this issue, not just in the U.S., but in other countries, have changed their tune with respect to a number of elements. Take the mask, okay? Back in February and March, Dr. Fauci didn't think you needed to wear a mask. I view him as probably one of the most credible people on this issue you're going to find anywhere in the country. He changed his mind when people started to realize how big the asymptomatic element that could spread the virus was associated with COVID. I think the big thing is that we all know at this point sort of what the basic issues are associated with this. We have a pretty good idea about what the things we need to do to manage and deal with it and contain it going forward are. We've done some of the things to put in place the mechanisms to take care of that, contact tracing, the testing regimens, a lot of PPE for people who serve vulnerable populations and work in the healthcare system or in the emergency response community. There are a lot of things that when this thing got started, I felt like we were playing catch up on every single day. And I think, as I've said several times, I hope we all learn the lessons, not just here in Massachusetts, not just in Boston, but across the country and hopefully around the globe, about what you need in place as your key elements to battle this as we go forward.
Do you give us credence now that information comes out of the feds? Do you trust but verify now?
I mean, I guess what I would say is we've developed a lot of relationships with many of the infectious disease and epidemiological folks who are here in Massachusetts, and they are in many respects the first people we call when we're looking for guidance and advice on a lot of these issues.
Any concern with baseball starting? Going to be teams any concern with baseball getting ready to start up, teams coming into Fenway, Sox leaving town, coming back, that could create a small hot spot?
There's a lot of testing protocols associated with the way Major League Baseball is setting this whole thing up. We're waiting to receive something from them, like a final document, aren't we? That we'll obviously give to our public health folks and to our medical advisory board to take a look at. I think the long story short on that one is they need to put in place a very aggressive testing program. There aren't going to be fans in the stands. My understanding is they're not going to use the locker rooms. People are going to come, as they do actually when they play baseball in many other parts of the country, parts of the world. People are going to show up dressed to play, and they're going to leave with their uniform on. And I think a lot of the things that baseball and the other professional sports have been talking about are the kinds of things that are must-dos with respect to getting back into this business.
Governor, last week when you unveiled your Holyoke plan, it seemed to differ in one respect from what Mr. Pearlstein recommended on the licensed administrator as a superintendent. Can you explain your reasoning for that slight difference? You had a preference, he had have a license.
Yeah, I think the performance of Val Liptak, who's a nurse, who still is the CEO of Western Mass Hospital, but has been the interim superintendent at Holyoke since March 30th, has been extraordinary. And I would hate to miss out on an opportunity to put a talent like that in place at Holyoke if a talent like that is available. I do think the most important thing that has to happen here is the person who becomes the next superintendent needs to be somebody who has a solid resume with respect to their experience and their track record in managing in clinical settings, managing infectious disease, and having a sterling set of recommendations coming from wherever it is they've worked previously. The other thing I would say is I would love to have those two healthcare people that were recommended by Pearlstein in his report serving on the board to be part of the conversation with respect to whoever succeeds Val, who at some point will go back to Western Mass and stop being the interim there. But I would hate to lose a talent like that.
Thanks, everyone. Would you like to see a Chelsea investigation? Several.
We put together first of all, Chelsea is not Holyoke. I mean, I just want to make that really clear. Almost everybody who's had anything to do with Chelsea will tell you that Cheryl Poppy did a terrific job under what everybody would agree are extremely difficult circumstances in managing long-term care facilities with vulnerable populations. I mean, some really spectacular private sector long-term care and assisted living providers have had enormous difficulty in managing COVID as well. In some cases, because of the guidance that changed with respect to a whole bunch of issues around asymptomatic carrying and other issues. But what I would say is that we are bringing in a group of infectious disease specialists, similar to what we've done in the long-term care industry generally in Massachusetts, to basically do a top to bottom on Chelsea and make sure that if there are practices that can be improved on or things that should be done going forward, particularly as we start to think about whether or not there's going to be a surge in the fall, that we're prepared, that they've got the gear, the equipment, and the protocols and the policies in place to make sure that they do everything they can to weather their way through the fall if there is a surge then, which a lot of people are speculating there may be.
Thank you.
Thanks.